Muscle loss in seniors is not just a cosmetic issue. It's a serious health problem that leads to weakness, frailty, increased falls, fractures, hospitalizations, and even higher mortality rates. In the United States, this is one of the most common age-related changes that ends up destroying independence. It's called sarcopenia, and it silently steals strength from millions of older adults across the United States, United Kingdom, Canada, and Australia every year. By the time many people reach their 70s, they've already lost up to 30% of their muscle mass. But the most tragic part is that many of them could have prevented this simply by eating the right foods consistently. The first food on the list is eggs, especially pasture-raised whole eggs with the yolk. Not just the whites, because the yolk contains most of the critical nutrients for muscle repair. Eggs are one of the richest sources of leucine, an essential amino acid that plays a direct role in muscle protein synthesis. Seniors often suffer from what's known as anabolic resistance, meaning their body doesn't respond as strongly to protein as it did when they were younger. Leucine is one of the few nutrients that helps bypass this resistance. In the United States, many nutritionists working with elderly patients are now pushing for whole eggs to be reintroduced into diets that previously excluded them due to cholesterol myths. The reality is this: without adequate leucine, your body simply can't build muscle, and without high-quality protein like eggs, it becomes a losing battle. Second, we need to talk about wild-caught salmon. Not farm-raised, but real wild-caught. This fish is extremely rich in omega-3 fatty acids, which are known to fight chronic inflammation, a condition that worsens muscle loss in older adults. Chronic low-grade inflammation is one of the key reasons sarcopenia accelerates with age. The omega-3s in salmon, especially EPA and DHA, have been shown in studies from Canada and the United Kingdom to enhance muscle protein synthesis and improve physical performance in the elderly. Older patients who consumed omega-3-rich fish several times per week showed significant improvements in walking speed, leg strength, and even balance. For seniors who've already begun experiencing weakness or frailty, this isn't just beneficial, it's necessary. Omega-3s help reduce muscle breakdown while encouraging muscle growth in response to physical activity, even when that activity is limited due to joint pain or arthritis. Third, Greek yogurt, especially plain, unsweetened, full-fat Greek yogurt, has become a go-to recommendation among geriatric dietitians in the United States and Canada. It's packed with high-quality protein, particularly casein and whey, both of which help maintain muscle tissue when consumed regularly. It also contains calcium, magnesium, and probiotics that support bone health and gut function, both of which directly influence muscle metabolism. Seniors often suffer from reduced appetite, and Greek yogurt can be an easy, palatable way to deliver essential nutrients without causing digestive issues. Many assisted living facilities in the United States now include high-protein dairy snacks like Greek yogurt during meals to combat muscle wasting in residents. But it's important to avoid low-fat or sugar-filled versions because they cause blood sugar spikes that work against muscle health. Fourth, bone broth deserves attention. Traditional bone broth made from simmered beef or chicken bones is rich in collagen, gelatin, and amino acids like glycine and proline. These are essential for maintaining connective tissue, ligaments, and tendons that support muscular strength. Seniors across Australia and the United Kingdom have been reintroducing bone broth into their diets as part of natural therapies to counteract age-related frailty. In many cases, people in their 70s and 80s report reduced joint pain, better digestion, and a noticeable difference in physical function after just a few weeks of drinking bone broth daily. The collagen in bone broth supports the fascia that connects and holds the muscles in place. Without that structural support, even well-developed muscles can't function properly. For aging bodies that are vulnerable to both injuries and slow healing, bone broth offers nutrients in a form that's easy to absorb and incredibly powerful. Fifth is chicken thighs, not chicken breasts. Thighs have more myoglobin, which carries oxygen to the muscles, and more intramuscular fat, which is actually protective in older adults. In the United States, the over-obsession with lean meats has led many seniors to eat bland, overcooked chicken breast that offers little in terms of energy or nutrient density. Chicken thighs provide a good dose of heme iron and zinc, both essential for muscle oxygenation and tissue repair. Studies in aging populations across Canada and the United Kingdom have shown that older adults with iron or zinc deficiencies experience more rapid muscle degradation and are more prone to fatigue and exercise intolerance. This is why, culturally, traditional cuisines that emphasize full-fat meat cuts often show less incidence of sarcopenia in the elderly. Chicken thighs, especially when cooked with the skin on and prepared with anti-inflammatory herbs like turmeric or rosemary, become an ideal meal option for muscle preservation. Number 6 is quinoa, a complete plant-based protein that's incredibly useful for seniors who might struggle with meat digestion or follow a more plant-forward lifestyle. Quinoa contains all 9 essential amino acids, unlike most grains. It's also rich in magnesium and potassium, minerals critical for muscle contractions and nerve signaling. Seniors in the United Kingdom and Australia who replace processed grains with quinoa often report better energy levels and muscle function over time. Magnesium, in particular, is often dangerously low in seniors due to common medications like diuretics and proton pump inhibitors. This deficit makes muscle cramps, weakness, and even heart arrhythmias more likely. Quinoa helps replenish that, while also delivering fiber that supports healthy blood sugar levels. Important because glucose instability directly affects muscle metabolism. A bowl of quinoa mixed with olive oil, leafy greens, and grilled chicken or beans becomes a potent muscle protective meal. Next on the list is cottage cheese, especially the high-protein, low-sodium varieties. Cottage cheese is rich in casein, a slow-digesting protein that provides a sustained release of amino acids into the bloodstream. This is particularly helpful when consumed before bed. In the United States, many geriatric nutrition programs are now teaching seniors to use a small bowl of cottage cheese as a nighttime snack to protect against overnight muscle catabolism. This matters because muscle breakdown often happens during long fasting periods, especially during sleep. Casein helps slow that down and supports muscle preservation throughout the night. Cottage cheese also contains B12 and selenium, both of which decline with age and are crucial for energy metabolism. If a senior is struggling with fatigue, cognitive decline, or muscle weakness, low B12 might be involved. Including cottage cheese several times a week becomes an effective tool not only for muscle maintenance but for general vitality. Number 8 is beef liver, though many people in the United States and Canada have forgotten about this incredibly nutrient-dense food. Liver contains massive amounts of vitamin A, iron, B12, folate, and CoQ10, all critical for building and fueling muscle tissue. In older adults who feel sluggish, tired, or unable to recover from mild activity, liver can offer almost immediate benefits. In fact, in studies from the 1970s and 1980s, athletes who consumed liver had better endurance and faster muscle recovery. The nutrients in liver aren't just good for muscle, they support mitochondrial energy production, meaning they help the cells that power your muscles work more efficiently. Many seniors find it hard to digest heavy meats, but liver, when cooked properly and consumed in small portions, is actually easier on the body and more effective for replenishing critical nutrients. Seniors who feel like they're aging too fast or shrinking often have underlying nutrient deficiencies that liver helps correct almost instantly. Muscle breakdown in seniors doesn't happen overnight. It's a slow, relentless process that often starts unnoticed. One skipped meal turns into frequent undereating. A drop in physical activity from a minor injury becomes months of muscle atrophy. In the United States, this pattern is devastating millions of older adults every year. And even more painful is that many seniors believe it's just part of aging, when in fact much of this loss is preventable and even reversible with the right nutritional approach. Every meal becomes either a step toward strength or a step toward weakness. That's how critical it is. We already talked about foods like eggs, wild-caught salmon, Greek yogurt, bone broth, chicken thighs, quinoa, cottage cheese, beef liver, spinach, and whey protein isolate. Now we need to look at how seniors can use these foods correctly and what nutrients help them actually work better. For starters, timing of meals is crucial. In the United States, many older adults unintentionally fast for too long, either because of poor appetite, medications, or simply forgetting to eat. When protein isn't spread out evenly during the day, it can't be absorbed efficiently by aging muscles. Researchers in Canada found that seniors who consumed at least 25-30 grams of high-quality protein at each meal, especially breakfast, had significantly more lean muscle mass than those who ate the same amount of protein, but in one large dinner. It's not just about what you eat, it's about how you space it out. Skipping breakfast or eating toast and jam sets up the body for muscle loss by depriving it of early-day amino acids that are needed for regeneration. Vitamin D becomes the next silent factor. Seniors across the United Kingdom and Northern United States are highly deficient due to reduced sun exposure, aging skin, and medications that deplete vitamin D reserves. But vitamin D is not just a bone vitamin. It directly influences muscle function, strength, and repair. In fact, vitamin D receptors exist on muscle cells, and without this nutrient, muscle contraction and protein synthesis are weakened. In a massive meta-analysis, seniors with low vitamin D levels had more frequent falls, slower walking speed, and decreased grip strength. Australia's aging population, particularly in nursing facilities, has adopted strict vitamin D screening and supplementation practices for this exact reason. Combining vitamin D with calcium-rich foods like Greek yogurt or cottage cheese is far more effective than isolated supplementation. The synergy between these nutrients improves muscular balance and helps prevent fractures during falls, which is one of the most dangerous complications of sarcopenia. The next layer is creatine, which most people in the United States associate only with bodybuilders. That's a massive misunderstanding. Seniors are one of the most responsive groups to creatine supplementation because their natural creatine production declines with age. Creatine helps supply quick energy to muscles, especially during short bursts of activity like getting up from a chair, climbing stairs, or catching yourself from a stumble. Multiple clinical trials have shown that even without intense exercise, creatine helps preserve muscle mass, improves functional strength, and enhances cognitive performance in older adults. In the United Kingdom, creatine is being studied as a non-drug intervention to reduce frailty. And it's incredibly simple to use, 5 grams per day, mixed into a smoothie or glass of water, often taken with whey protein to maximize muscle-building synergy. For seniors who fear resistance training due to joint pain or past injuries, creatine becomes a foundational nutrient that allows even mild daily movement to generate meaningful muscle response. Hydration is a critical but often ignored piece of muscle health. Aging bodies lose the thirst signal, which means many seniors in Canada and the United States live in a constant state of mild dehydration. Dehydration shrinks cells, including muscle cells, and makes amino acid transport less efficient. It also increases the risk of muscle cramps, poor coordination, and fatigue. Drinking enough water is not about guzzling gallons. Rather, it's about spreading hydration throughout the day and pairing fluids with electrolytes like magnesium, potassium, and sodium. Foods like spinach, avocado, and salmon help here, but sometimes seniors need more, especially if they're on diuretics or blood pressure medications, which flush out vital minerals. Adding a pinch of Himalayan salt or using low-sugar electrolyte powders can make a dramatic difference in hydration status and muscle function. In Australia, where temperatures can climb quickly, this is now standard in many elderly care homes. Next, we need to talk about insulin resistance. Seniors across the United States and United Kingdom often suffer from prediabetes or type 2 diabetes, even when they're thin. Insulin resistance blocks nutrients from reaching muscle cells, causing muscles to shrink despite eating enough protein. Blood sugar spikes and crashes also cause fatigue, which reduces activity levels and accelerates muscle wasting. Quinoa, spinach, and Greek yogurt are ideal here because they regulate blood glucose levels and provide steady energy. Avoiding sugary snacks, white bread, and processed foods is mandatory, not just for diabetes management, but for protecting muscle. Several studies in Canada found that seniors who reduced refined carb intake and focused on low glycemic whole foods showed marked improvements in muscle strength, walking speed, and even sleep quality. Because when blood sugar stabilizes, hormones like growth hormone and testosterone, which also support muscle, can function more effectively. Zinc is another nutrient that gets overlooked. It's essential for muscle repair, testosterone production, and immune function. In aging males especially, zinc deficiency leads to rapid muscle decline. Chicken thighs, beef, pumpkin seeds, and even dark chocolate are excellent sources. In the United States, nearly 40% of older adults are estimated to have suboptimal zinc levels, and it's even worse among those in long-term care. Without zinc, wounds take longer to heal, muscle tears repair slowly, and exercise recovery is impaired. Zinc also affects taste and appetite, so if food starts tasting bland, it could be a sign of deeper deficiency that leads to undereating and even more muscle loss. Ninth is spinach, not because it's high in protein, but because of its nitrates. Spinach is one of the richest plant sources of naturally occurring nitrates, which improve blood flow and oxygen delivery to muscle tissue. In aging adults, poor circulation is a massive issue, especially in the United States and United Kingdom, where sedentary lifestyles and poor diet choices compound this problem. When muscles don't receive enough oxygen, they shrink, weaken, and stop functioning. Spinach helps open up blood vessels and supports endurance, which makes physical activity less exhausting and more effective. In trials where older adults consumed spinach or nitrate-rich beet juice daily, improvements in walking endurance and leg strength were significant. Even better, spinach also contains magnesium, potassium, and plant compounds that reduce inflammation, another driver of muscle breakdown in older populations. A daily handful of spinach in a smoothie or cooked in meals can make a real difference for aging muscles. 10th is whey protein isolate, not concentrate. Whey isolate is stripped of most lactose and fat, making it easier for seniors with digestive issues to tolerate. It is extremely rich in BCAAs, branched-chain amino acids, which directly stimulate muscle protein synthesis. Seniors in the United States who begin resistance training programs are almost always recommended to consume a high-leucine whey protein shake within 30 minutes of exercise. The elderly body doesn't respond to training the same way a 25-year-old's body does. It needs higher quality protein delivered in strategic timing. Whey isolate provides exactly that. It's fast absorbing, and studies show it can trigger muscle growth even in seniors who perform minimal exercise. For people who are chair-bound, recovering from surgery, or too weak for a gym, this shake can help preserve muscle mass and prevent further degradation. In Canada, many rehab centers now include whey isolate in recovery diets for seniors who've experienced long hospital stays to accelerate muscle regeneration and improve long-term mobility. Let's get into inflammation, because it's not always visible, but it's destroying muscles quietly in the background. Chronic inflammation, driven by poor diet, processed food, lack of movement, and stress, disrupts muscle regeneration. It blocks protein synthesis, breaks down existing muscle tissue, and increases the risk of mobility loss. Omega-3 fatty acids in wild-caught salmon or sardines directly counteract this, but it goes deeper. Anti-inflammatory herbs like turmeric, ginger, and garlic have shown remarkable effects in reducing muscle pain, enhancing recovery, and improving joint flexibility. Seniors in Australia who regularly consume turmeric-spiced meals have shown better grip strength and joint movement in observational studies. Turmeric combined with black pepper increases absorption of curcumin, its active compound, by over 2,000%. Including this combination in bone broth, chicken dishes, or even smoothies is a simple but powerful habit that can cut down muscle-related inflammation drastically. Gut health now needs to enter the conversation. Poor digestion means poor nutrient absorption. Even if a senior eats the perfect high-protein meal, if their gut is inflamed or filled with harmful bacteria, it won't matter. Probiotics from fermented foods like kefir, sauerkraut, and plain Greek yogurt support a balanced gut microbiome, which influences everything from inflammation to amino acid uptake. Seniors across Canada are now being encouraged to take gut health seriously, especially those on multiple medications like antibiotics, NSAIDs, and proton pump inhibitors. These drugs destroy gut bacteria and open the door to malabsorption, gas, bloating, and nutrient deficiencies, all of which reduce appetite and further increase muscle wasting. In the United States, elderly patients with muscle-wasting conditions often test positive for gut dysbiosis, and correcting it leads to improved energy and food intake within weeks. The conversation cannot be complete without addressing movement. Synergy, what seniors eat, works better when paired with light physical movement. Not intense workouts, but resistance bands, walking, bodyweight squats, or even simple chair exercises. In Canada, studies have shown that a combination of 30 grams of high-leucine protein with 15 minutes of light resistance training produces significant muscle gains in seniors over 65. The key is consistency. Food and exercise need to work together. Whey protein isolate with creatine post-walk, cottage cheese before bed, eggs with spinach at breakfast. These combinations not only feed the muscles,